I thank Dr. Vijay and his team for giving me this opportunity. And it's a difficult topic. So I asked my wife, Vijay asked me to talk on philosophical. Then she said, don't dye your hair, go like that. Because we are supposed to look elderly, otherwise it's difficult. Because it's philosophy means everybody thinks it's a elderly thing. Sir, 1 minute, sir. They are working on some. No. Oh, can you copy and? So, philosophy is different for different people. For me, I believe in laughter yoga. Laughter yoga means we promote laughter to control various chronic problems. We don't promote that this laughter yoga will treat you, but it's an adjuvant therapy. You use your medicines, you do your things. Like Sir said, he's doing 250.
Super bright.
Yes, right. Something like that. What we do in laughter yoga is we try to we get all the benefits of laughter. The problem is we are not laughing enough. When you are a kid, you used to laugh 400 times a day. But as you become an adult, you will think of the reason, why should I laugh? Even if your friend jokes, you will say, why should I laugh? So we are losing the opportunities to laugh. So what we do in laughter yoga, we form a group and laugh together. As you know, laughter is contagious. I visited nearly with the doctor nearly more than 20 to 30 countries. Wherever we go, if you laugh, someone will laugh. If you smile, other person will smile. Because smiling and laughter, they are universal languages. So if you start laughing, and the other person will automatically laugh. Laughter has shown that it controls blood pressure, blood sugar. It prevents so many problems, and even if the patient is going to develop some complications, they found out that it will prevent complications also. So I already told you, we are not promoting it as a entire treatment. We are promoting it as a adjuvant therapy. As you know, adjuvant means we are giving some supportive therapy. And we wrote in some articles about laughter therapy in diabetes and gelitology. I call myself gelitologist because gelitologists, we promote laughter as an adjuvant therapy. So what we will do in laughter yoga is we laugh together more so that we will get all the benefits of laughter. How I came to this is I studied an article in Japan, a doctor. He simply did a small experiment. What he did was he gave isocaloric diet and he showed a very boring TV and measured the postprandial blood sugar. And next day what he did was he showed a comedy and he measured the postprandial blood sugar. What he found out is when he showed the comedy show, the glycemic rise was less. So after eating, if you laugh for some time, your blood sugar will be less. He says that it was around 30% postprandial was less. I tried in my clinic and we got the same result. So what I believe is if you laugh more, you will have more benefits. What I promote is, I may say it's not possible to do for you to do laughter yoga, but you take more opportunities to laugh. Whenever you have a chance, laugh. That's what I promote. Okay, let us start by laughing together by 1 minute. So, will you laugh with me? I am challenging you. Please laugh with me. So, very good, very good. Hey, we always say that for anything we should be happy. So, you try to laugh more, laugh with your family, laugh with your friends, and particularly 4th May is World Laughter Day. I am promoting you all to smile with your patients. At least laugh or smile because they need it the most. They are waiting. If Sanmugam's clinic, they will wait 4 or 6 hours to see him. So when they come inside, please smile with them. They will feel very happy. And I am doing that, and I feel they are very comfortable and they love you also. Sometimes they may kiss you also. One lady kissed me. She is very old, sir, please. Okay, thank you. So what I will do is, today I will talk about philosophical way to manage diabetes. So philosophy at its core is the love of wisdom, a pursuit of understanding the fundamental nature of existence, knowledge, values, and reason. Then philosophy also includes practical applications like guiding principles for behavior, how we should behave. This is philosophy. And then I thought, what is wisdom? Wisdom is the ability to apply knowledge, experience, and good judgment to navigate life's complexities. So we may have knowledge, but we need wisdom to do things. These two things are different. In essence, wisdom is not just about knowing what is right, but also about acting upon it in a way that benefits oneself and others. So diabetes management can be approached through a philosophical lens, integrating wisdom from various traditions to foster a holistic and mindful approach to health. Here are some of the philosophicals. What I did was Bhagavad Gita I took, because Bhagavad Gita, which I learned during our COVID days. What I did was I underwent one online course where I learned Bhagavad Gita. But Bhagavad Gita has 700 slokas. You can't learn everything and you can't use it. But what I felt is, after thinking about it, I realized that there were many articles written on Bhagavad Gita. How can we use Bhagavad Gita to educate people about diabetes? So there is a term called as metabolic karma, means if you eat too much, you may get diabetes. Then self-management philosophy. What Bhagavad Gita says that is you should control your senses. So if you can control your diet by controlling your senses, it will come. And holistic well-being. It says that it's not only today, you have to take care of yourself in the future, everything. So this is a holistic approach, what we should do. First, I always remember one sloka. This is called, every one of us, you can chant with me, Yuktahara Viharasya, Yukta Chestasya Karmasu, Yukta Swapnava Bodhasya, Yogo Bhavati Dukkaha. What this says is, slides are gone. What this sloka says is that what this sloka says that, but those who are temperate in eating, recreation, balanced in work, and regulated sleep can mitigate all sorrows by practicing yoga. So if you are a diabetic, your yoga is to control blood sugar. So if you can control your eating, then recreation, balanced in work, everything you can control diabetes well. It's not moving. Yes. Yeah. Just go behind. I have to push there. Here? Okay. Okay. So the phrase Uktahar Viharasya is from Bhagavad Gita, 6th chapter and verse 17. What it says is, he who is temperate in habits of eating, sleeping, working, and recreation can mitigate all material plans by practicing yoga system. This verse emphasizes the importance of moderation in balance in life by regulating one's daily activities such as eating, sleeping, working, and leisure. One can create a harmonious lifestyle that supports physical, mental, and spiritual well-being. So, what these ADA guidelines say in 2025? Okay, I just enter. Which one? Okay. Just enter. Okay. Here, all right. So ADA guidelines also says that facilitating positive health and behavior and well-being, all these things, they say that by controlling proper diet, proper sleep, and stress reduction, which is all said in the above sloka. Yuktahara viharasya, yukta chestasya karmasu, yukta swapnava bodhasya yoga bhavati dakha. What Krishna says that if you can control your diet, exercise, if you can sleep properly, and if you reduce the stress, you will have very good health. That is yoga. It is also American guidelines also says that the same. So we have to remember that there's all these things were written in our scriptures long back, but we are not following. So this is about diet, and this diet also is, he says that the phrase Ayuk Sattva Balarogya, he mentions what diet you should eat. What it translates is foods dear to those in the mode of goodness. If you are feeling, if you want to be good, increase the duration of life. I mean, if you eat these foods, you will have more longevity, and purify one's existence and give strength, health, happiness, and satisfaction. Such foods are juicy, fatty, wholesome, and pleasing to the heart. So if you remember these, what food will come to your mind? For South Indians, Tair Sadam, because it's juicy. But what I feel is, it is promoting vegetables and fruits. So if you can take this, you can prevent diabetes also. So so fruits and vegetables belong to this group. And as you know, the health benefits of fruits and vegetables. And another thing is, he says that nachas natastu yogosti. He also says that if you sleep too much, that is not good for health. And if you sleep less, also not good for health. If you eat too much, also not good for health. And if you eat little, also not good for health. So what I want to tell is, if you see the diabetes control and sleep, it is a U-shaped curve. If you sleep too much, you won't get good control. If you sleep less also, you won't get good control. And if you eat too less, you will get hypoglycemia. If you eat too much, it is also not good for health. So everything in moderation is good for health. And now everybody talks about work stress. We are stressed. We had a session about software people. He clearly says one sloka, which is everybody of you knows, karmanye vadikarasya. What this sloka says is, you do your duty, but don't worry about the result. Now I brought the slides, it's not working. We shouldn't be tensed. So what Krishna says is, if you do your duty properly, there is a chance of getting success. We are all concerned about the result more. We are not worried about doing our duty properly. If you can use this sloka, then you will have less stress. You do your duty and leave the result to the God or nature, whatever you will. But you do your duty sincerely. This is a stress buster, because we are all oriented about the result. We want result, we want result. Even before coming here, I am thinking how my speech will go like that. So if you do your duty, it will be good. And another thing is, then as soon as Krishna says that, okay, you control this, that, then Arjuna says that it's very difficult to control your mind. Because for a diabetic, we will tell, you don't eat this, you don't eat that, go for dance, madam is going to dance, make them dance. So go for exercise. But it's very difficult. At the same time, Krishna says that I know Arjuna, it's very difficult. Even if for Arjuna also, it's very difficult. But keep on practicing. Two things are there. One is vairagyam, means detachment. You have to forego some foods. And at the same time, you have to control your mind. So these things were told by Krishna. Everything we had to do in moderation, and then slowly we have to learn how to do these things. And everybody says that why we get anger. Many people, our problem is anger management. They say anger management. Why we get anger? Krishna says that we will develop attachment to certain objects or certain things, and that will lead to you will be carving for those things. It is called lust, and lust will make you anger. So try to reduce these worldly things, then you will feel better. Okay, I told you about laughter and other things. I want to show you this song.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, किसी की मुस्कुराहट.
So what this song says is, he's a poor fellow, but he's very happy. So what he says is, what I like about this song is, the purpose of life is to make someone happy, someone smile, and by reducing their problems. I feel as doctors, we are doing it every day. So let us clap ourselves. We are good because we are treating someone and we are changing their lives. If I told you, one lady went around for control of diabetes. She's 80 years old and she couldn't get her sugar controlled. So I controlled her sugar. She was waiting for cataract. Then she was so happy because cataract, we think it's a minor problem, but they can't see. So she came and kissed me. I told you, that's why you will get a lot of kisses if you smile with your patients. So what he says is, give your shoulder to someone and make someone happy. They say that the purpose of our life is to make someone happy. As a doctor, we have a lot of opportunity to make things happier for the other people. Research also shows that if you want to be happy, you make other people happy. So we are at the good opportunity of making others happy. So do it properly. This is a slide where we laugh together. Whenever I get a chance, I laugh with my patients. Whatever the day, we celebrate. We celebrate laughter day, smile day, everything. Just smile with your patients and laugh few minutes with them. They will be very happy. This is about philosophy. My advice to you is get married. If you find a good wife, you will be happy. If not, you will become a philosopher. I'm not a philosopher. So what I want to tell you is, yoga is attainment of moksha. For people with diabetes, is a good health and good control. These slokas can be used to motivate people for diet control, exercise, proper sleep, stress relief. And these are all the slokas you can get in Bhagavad Gita. And what I feel is, if you tell through religion, they will act more. Okay? So let us be active and smile with your patients. Thank you very much.